Hoping to stave off a coronavirus infection, an Arizona couple poured the chemical additive known as chloroquine phosphate into a soda and drank it. The additive is commonly used to clean fish tanks. However, the couple did so because the chemical name is very similar to the pharmaceutical name chloroquine and its derivative hydroxychloroquine, drugs approved by the U.S. Food and Drug Administration (FDA) for treating malaria, lupus and rheumatoid arthritis. They'd heard and seen President Donald Trump say during a news conference and tweet that chloroquine was a possible cure for the coronavirus. But within 30 minutes of ingesting the chloroquine phosphate, the husband died of cardiac arrest. His wife was hospitalized. What is chloroquine? As the name implies, chloroquine is a derivative of quinine, and is typically used to prevent and treat malaria and amoebiasis. Malaria is spread through mosquito bites. Amoebiasis is spread through parasites found in contaminated water or food. Chloroquine is typically taken as a preventative. If you're going to a place where malaria is present, you take it for 2 weeks before traveling, then while you're there and then for 8 weeks after you return. It's also the drug doctors prescribe to patients who have acute malaria attacks. They take a dose immediately, then half the dose 6 to 8 hours later. Hydroxychloroquine is an equivalent of chloroquine. That essentially means the two drugs are similar in structure, but different in their chemical and biological properties. Chloroquine is considered less toxic than hydroxychloroquine, according to a new study. Both have been fast-tracked by the FDA to study their effectiveness at treating coronavirus. Chloroquine is typically taken with food because it can cause an upset stomach. It can also cause itching, headaches, loss of appetite, diarrhea, stomach pain, hair loss and mood changes. Patients taking chloroquine for long-term illnesses will need to have regular eye exams to guard against a rare eye condition called retinopathy. Can chloroquine cure coronavirus? While President Trump specifically mentioned hydroxychloroquine in a tweet March 21, and appeared to base his assumption on a single small study out of France that combined the drug with the common antibiotic azithromycin, the results are only anecdotal. The information included just 20 patients, who were studied for 6 days. The research was neither peer-reviewed nor published. So at this point, there are no published scientific studies to support that chloroquine, or any other medication, will unfortunately cure or prevent coronavirus. And stockpiling will only be taking necessary medication away from people who need it. The best preventative we have to slow the spread of coronavirus right now is social distancing and proper hand washing. And by all means, don't ingest the chemical form of chloroquine phosphate. Stay away from it entirely, unless you need to clean your fish tank.